Sioux Lookout First Nations Health Authority, or SLFNHA, presents SLFNHA Radio Connect, building strong connections with communities by sharing who we are, how we can help, and the services we offer. Ako Wiindamekewinan, Sioux Lookout First Nations Health Authority Gajgadig, Egochkea Eskam SLFNHA Mijinkade. Kiiwetinoong iwanun Keguns Wichi Guyagban Ima Ishkunaganang Kazgabeshig, Egochkea iwanun SLFNHA Wiindamekewinan. Greetings. My name is Charles Mikas, and I will be your host today. I currently work in the Wiindamekewinan department at Sioux Lookout First Nation Health Authority. And I'm originally from Sandy Lake First Nation, and I've been with the organization now for about 8 years. Bojo waje gidna hegama ngagakugajma oguma kegunenan iwenun akuzi mujiganan imanake Sioux Lookout First Nations Health Authority. Welcome to today's program. We're excited to have Katie Wantaro to speak about the programming and the services at the primary care team at SLFNHA. Welcome, Katie. Miwe kche bojo gidnguna miwe migwech ka bizindamig nom iwe gawista dazindamang awe Katie Wantaro jinkaza awe basic gaganwabindang iwe hi primary care gajgadeg miwe kana nagachinda ishkunganang kaunjiwaj nanda gai napanewaj ego miwe ahing ma SLFNHA basic ankuiniwe numunendam ni maga kaiseg jibizain Katie.
Thank you so much for having me today. I'm very excited to be here and share some information about my team.
Migwetskabi ayausian nongum gagizgak. Najikeen dan che deba che magwa Wiindamekewinan.
Before we start, please tell us about yourself and your history with SLFNHA. What was your journey to becoming the director of the primary care team? Ega menuguk iwanun ankunan geda dazindamak gdawin da mosnam na and awen jian awen engin egochke gagabiese gapenugi maga gnigan skamaniwa primary care team gajgadik.
Yeah, for sure. So I am from Norwick, which is a small town about 45 minutes away from Sioux Lookout. So if you're driving out of Sioux Lookout towards Dryden area, it's just the turnoff on the left. I did go to university in Thunder Bay for both teaching and kinesiology. My dream was actually to be a gym teacher. I was very fortunate enough to go and teach grade 6 in the Caribbean for a year, and then prior to getting my kin job in Sioux Lookout with the diabetes program. So after that, I moved into the hospital at Sioux Lookout, where I was a kin, like a kinesiologist, in the rehab department. Then I worked a little bit in the diabetes program, as well as I ran the cardiopulmonary lab at the hospital. So with all that, I still eventually knew I wanted to be in more of a management role, and I switched over to SLFNHA as I thought there'd just be more opportunity for management. So I've been very fortunate. I've worked with SLFNHA for just over 7 years now. I started in October 2018 as a kinesiologist, and during that time I was able to travel into communities quite frequently, which was so nice. Then I moved into the clinical manager position to help support the growth of the team. After that, I moved to the director role where I can help oversee the program and where I'm still currently working now.
Norwick and Donchi. Otenas nimedanas nyan sab de baigane sa pichnagwan wananaangak. Kispin pemaji besian. Wananaangak. Mihima esiate ka onche pakebesnan wan Dryden nappen. Kai spag skoni winning ningiza pinesi washank. Skoni hiwewen. Mina mia wakawiwan egi skonian. Ningi nentana pan metawewanan che skoni hiwean. Ningi is a minuse. Ningutoaso Kiiwetinoong eki skoni wean pesiguiake Caribbean. Shawanong ksimokmanakink. Minnegokabe anokana kwa Wusogawahpenik che Wakawiwach Wiindamekewinan. Kusiwu gamagong ningi se andanoki eki Wakawihagwa Omaskikek Omenakwek Wusogawahpenik mina ningi Pimban tuan Ote mina Opan Wiichiwewinan. Ninki kekentan api ewi okamawian. Mina ninki ane anokawa Solakaut First Nations Health Authority egi nendaman homa nawat chiane tepnaman wibat okamawan. Ni swasuake ninki Wiindamekewinan Solakaut First Nation Health Authority. Nigimatanuki 2018 Wakawiuneng mina nigi Aisha apeweneng wahuipat mawache gimenwendaman. Mina wach nigiane nigan skawag maskkikwek eki wichagwach nagachtoach Wiindamekewinan. Nage ka ispag okamawan director ningi ane tepenan ene kanawendaman chiminsek akusi wichiwewinan mina himagiabe nintanoki.
At Sioux Lookout First Nations Health Authority, we're committed to building strong, supportive teams, and we focus on hiring First Nation employees wherever possible. Whether you're just starting out or looking for a career change, SLFNHA offers competitive wages, comprehensive health benefits, a pension plan, and even fitness reimbursement. Visit www.slfna.com/careers to explore current opportunities. SLFNHA, health careers grow here.
Thank you so much. Now let's get into the work that the primary care team does at SLFNHA. Can you explain about your department and its role within SLFNHA? Ega miwe ktsimigoetskid nugo iwe gagawin de mosyang. Egwetske egwa chwin de mosyang anin mayam iwe gdanchwin gabmuduin an mayam inanchwin. Kegunen iwenun ahing SLFNHA gajgadik.
Yep. So you may have heard about our team and how we have pods that work together as a team to help care for clients. We travel into the communities to try and provide care closer to home for our clients. We may see clients in places like the nursing station, during home visits, as well as in other areas such as like community health hubs, alongside other programs and in community halls. Our team works collaboratively to provide preventative care, monitoring, and treatment of chronic diseases. We focus on helping clients build skills to self-manage their health and well-being.
Kikinutanatok nintanoki na kanananak mina ka ese okko Wiindamekewinan kanawenamawach utahkusin. Apuning Nintasamen handawe wich hangata utahkusi kasi kapeswat. Nikaki wapamamen utahkusik maskakiw kamagong wakahiganwang wich hiwewanan kasi wapamawat utahkusin. Hunse Wiindamekewinan Wiichiwewinan mina mawat hitiu kamigong. Na Wiindamekewinan Wiindamekewinan Kwayak Wiindamekewinan Nanakatihituwin Mina Wichihintoka Kichi Ahkusuwach Niwichihamin Kishi Wiindamekewinan Ane Mashkawatasuwach.
Could you tell us about the different services offered by the primary care team? Are all the services offered to community members? Ego gadawin demotionam na anin mayam ankhwiunan anin ezwichin da anshinwag ego anshna beg ishkundagan ngayawat kegunenan iwanun kananaga chinda udakuzig kegunen iwanun gadawin demotionamna.
So for our program, we are trying to reduce barriers for clients accessing care, so we accept referrals from many different sources, such as doctors, nurse practitioners, community nurses, home care workers, community health staff, and even self-referrals. Clients are able to either call our office in Sioux to put in a referral or talk to one of our workers while they are in community and put a referral in that way. You can also visit the nursing station in your community and ask them to put a referral in on your behalf. We have a lot of different healthcare workers and services in the primary care team. The pods consist of nurse practitioners, foot care nurses, community health coordinators, physiotherapists, kinesiologists, occupational therapists, dietitians, speech-language pathologists, wound care nurses, a social worker, as well as other many admin supports, such as telemedicine, pharmacists as well, and many admin. We are also working on adding ultrasound to our program. Currently, we have a contract worker that does a bit of work in one of our communities, but we are hoping that the program grows and we'll be able to offer it to the other communities as well. Right now, we have 3.5 pods that try and travel into each community monthly to provide services. We are still a bit short-staffed and hoping to add more human resources and staff to provide even more services in the communities.
Wiindamekewinan Ninkakwe Nikate Namen Ka Kibishkagowach Otahkusik Kewanchiminuyawach Mi Kawanche Otahpidamag Machine Pakanaik Utahkusika Pichin Zahonch Tabskuch Mashkakiwinan Wak Kichimashkakikwek Apawaning Mashkikwek Kichihan Ka Anukanawach Apawaning Ahkusiwe Anukinagan Mina Kekin Jishin Sahotisian Chawapamagoyan Otahkusik Nintaki Pikanon Komen Wananawankank We Pimachin Zahwach Nanta Chikanonach Nintanoki Nakananan Apawanik Pishanit Mina Hiwe Neke Hi Chiwinchi Wabamint Ntaki Za Mashkakiwgamagong Kitaki Za Mashkakiwgamagong Kitapawanik Mina Chikakwe Chimatwa Chimachin Zahugoyan Machine Papakan Ahkusiwe Anukinaganak Mina Wichiweunan Nintayamin Kazuaukan Kiwach Ayawag Kichimashkikwek Usitimashkikwek Utahkusin Ka Wichach Uzashi Pigbeneweg Waka we Anukinagan Ka Wichach Utahkusin Chitoche Iehtstamate Sunnich Inasangewe Anukinaganak nehtawe anukkinagan. Ahan haganan ka wijhat maskikwe. Otashange kaye kutagian wijhiwewanan tabeskuch pawahte sichikanyen kawanche wapamench maskikiwanane. Maskikine ka miigwech. Mina machine umas nahigesis anukinaganak. Nitan nukatamen kaye ka michemen katik. Kikiskawa so pawahte pichigan. Ewi huntanamank. Mekwach ndayawamen anukkinagan basic abonink sa goch ne pagkusendamen tiyan nestawikink mina pahkan abonan Kiiwetinoong tutamuach huwe mekwach ndayawamen nissen minapta Wiindamekewinan kakwe zawat aboning tasugizes handawe wichiwewat. Kiape ninonde semen anukinaganak mina nebagusendamen che nanginentoa anukinaganak mina wichiwewen with aboning.
Good day, everyone. My name is Dr. Lloyd Douglas, and I'm the public health physician here at the Sioux Lookout First Nations Health Authority. I want to talk to you about routine vaccinations. Our communities are strongest when we take care of each other, and that includes staying up to date with routine vaccination. Lately, diseases like measles are making a comeback in Ontario and in Manitoba and all across Canada. These illnesses spread fast, and without vaccines, they can cause serious complications, even death. But measles isn't the only concern. Other vaccine-preventable illnesses like whooping cough, mumps, or even certain types of meningitis can also threaten our health, especially for children, elders, and those with weaker immune systems. Routine immunizations help our bodies build protection before we're exposed. Vaccines are safe, tested, and free. Most are given during childhood, starting at 2 months, then continuing into school age. They are also important boosters for teens and adults. And if you missed any, it's never too late to catch up. Whether you're planning a trip, heading back to school, or just want peace of mind, now is the time to check your immunization records. Let's protect what matters most: children, elders, and your way of life. Talk to your healthcare provider or nursing station about routine immunizations. If you have questions, you can also email us at acwinfo@slfna.com. Protect our past, safeguard our future. Keep up with your routine vaccinations. This message is brought to you by the Sioux Lookout First Nations Health Authority.
Thank you for that. It seems like the primary care team is delivering many healthcare services to the north for our community members. Can you tell us more about the services for community members based in Sioux Lookout? Ega kchimigwechkidnigu, iwega Wiindamekewinan, iwenun primary care team ankiwen gab mudwaj. Ega anin ezwichinda anshinwa Kiiwetinoong. Ega Wiindamekewinan kegunena ne ehyagen ima hinga udenang Sioux Lookout gajalik.
For community members living in Sioux Lookout, the services are very similar to what we provide in communities. Some differences, though, is that we work with Sioux Lookout Meneawan Health Center to try and share some of the clients, specifically for rehab referrals, such as for physiotherapy, occupational therapy, or kinesiology services, as both organizations are a bit short-staffed in those areas. If you would like a referral to our program, You can stop by the primary care building at 55 Queen Street or give the receptionist a call at 807-737-5683 to put a self-referral in.
Apunin ka winchi watch wananawan gang kagabeshwatch wichiwenan kigat mayam isnagonon apunin ka mikuang kasi bakani agdas newitan kimamen menuyawan akusiugamik ikagwe wich hangdoch anokanawach nenda akusimenanan Mawach uta omenekwe omashkikike chuwich hinch umamino pendekowenink ke yeshe wich hitesoche tatu tamawitesoch nanda miawo wakawiwen wichiwewenan hoemegwach nishin bemawit Kiiwetinoong eno desewach utan kinakanuan. Kispen andawentaman chipisayan newid chiwewenanang pikipichin newakahigananang 55 Queen Street nanda Pekanos utas denchige hima 807-737-5683 Chipichinizahotisuyan.
Thank you so much for your time today. Lastly, can you share a few upcoming plans with the primary care team?
Miwag chimigwachkidngo iwa magaisig iwanun Ийнхwiunan gab mujgadegen jidadazindaman. Egwa dawin the moshnam na anin ejigmaunanung gab jiwenun kawyen khadamwaj iwa ang primary care team kazyen kuat.
We are currently in the process of changing some of our communities around so the communities that are part of tribal councils are all in one pod. So you may see some new faces in your communities in the new year. Our team is very excited to continue to work with the communities and looking forward to the new year.
Huemegwach nimami no samen nintabi winanang ka okwinawach tribal council. Basically, chisha witan kiimituach. Egwa kiga wapamak ushke wingwanak kitabuwinink api ushkekiwak. Nintan no kinakaninanag uchih kentanawa apawinink chisawach mina ahpich ubagusabandanawa kawi ushkiyakiwaninek.
So that concludes today's show. Thank you for tuning in to SLFNHA Radio Connect, where we are building strong connections with communities by sharing who we are, how we can help, and the services we offer. Connect with SLFNHA on our Facebook page or on our website at www.slfna.com. Miapanaguiwa atibseg noom imaga Wiindamekewinan akwazio Ийнхwiunan gab mujgadig ima SLFNHA Radio Connect. Bawajugu aikadnanun ishunganan suitan Ийнхwiunan anshinwagwa anshinabeg egotske anin gegizwichigueman iwa akwazio Ийнхwiunan gab mujgadig miwach.
Recorded and produced at Wawatay Communications Society.